On the Health Watch tonight, more kids have problems tied to fetal alcohol syndrome than researchers previously thought. For decades, of course, pregnant women have been told do not drink. But researchers examined more than 6,000 first graders in 4 communities across the U.S. and asked their moms whether they drank alcohol while pregnant. They found fetal alcohol spectrum disorder affects between 1% and 5% of children. Dr. Mallika Marshall is here, and that sounds like a lot of kids.
And that actually might be an underestimate.
Wow.
It might be closer to 10% in some communities. And fetal alcohol spectrum disorders, as we call them, can cause a number of problems. It can cause atypical facial features, behavioral issues, learning difficulties, growth problems, and in some cases it can actually be quite severe. Now, about 10% of pregnant moms admit that they have been drinking alcohol. Maybe not a lot, but unfortunately, I think there's sort of this trend among women to think, maybe a little glass of wine here and there, right? You've heard it.
Yeah.
And unfortunately, we don't know how much alcohol could possibly affect the fetus. So you really need to abstain completely. And the CDC has gone so far as to say that women of reproductive age who are not using birth control shouldn't drink at all. And that's because 50% of pregnancies in the U.S. are unplanned.
I do see the occasional mom-to-be saying doctors say it's okay to have one, but you say no.
No,
yeah,
not okay.
All right. Asthma rates among children in the U.S. are dropping, so this is good news. According to the CDC, the percentage of children with asthma fell by about 8% from 2010 to 2016. Hospitalizations were cut in half over a decade, and sounds like great news.
It is great news because asthma affects a lot of kids. Yeah. It's the #1 cause of chronic illness in children. And so to see the rates actually declining is really good because they were going up for a while. And that means less missed days at school, less missed days at work for parents taking care of their children, fewer kids having to deal with a chronic illness. That said, in 2016, half of kids with asthma still had asthma attacks. So we still have a lot of work to do. We need to continue to educate parents about triggers like cigarette smoke and mold and pet dander, and a really good job of teaching parents and kids how to properly use their asthma medications, because I see a lot of kids in clinic and parents who aren't exactly sure.
Just quickly, why is it getting better? Are we keeping cleaner homes?
I think we're doing better education, keeping cleaner homes, and I don't know that we know all the answers to that.
Okay. Dr. Mallika Marshall, thank you so much. Appreciate it. Lisa, over to you. All right.